Hello, sir. How you doing today?
Hey, I'm doing good. How are you?
Good. My name's Chris. I'm going to be your nurse for this afternoon. What we're going to do today is I'm going to do a couple assessments with you. I'm going to check your cardiovascular system just to make sure your heart's working properly. I'm going to check your peripheral vascular system. I'm going to look at some pulses, different places on the body, so I'm going to need to get in. Are you okay with me touching you?
Yeah, that's fine.
Okay, great, because it's going to be a little bit, some places might be a little bit uncomfortable because I have to really get in there and feel the pulse correctly. And then I'm going to also, are you breathing okay?
Yeah.
All right, I'm also going to assess your respiratory system also.
Okay.
Okay, but before we get started, let me go ahead and verify your name and date of birth here.
Sure.
I'm going to look at your arm bracelet. Okay, go ahead.
It's John Doe, 1 January 95.
Oh, okay, Mr. Joe. All right, so before we get started, I'm going to go ahead and wash my hands and we'll get going, okay?
All right.
Right.
Thank you.
Sure. Alright, so now that I'm all washed up, what I need you to do is just go ahead and sit straight up for me, nice and relaxed. Okay? What I'm doing now, so just taking a look and just make sure I don't see anything out of the ordinary. What we're looking for is any retractions, heaves, pulsating, anything that is not what the normal body flow would do when you're just sitting there, okay? Alright. Okay, so first thing I'm going to do is I'm going to assess your apical pulse. What I'm going to do is palpate, which is going to go ahead and, like I said, touch you, okay?
Okay, that's fine.
Okay, so what I'm doing is starting with the clavicle. I'm going down to the second intercostal space, right sternal border. And then I'm going to go 3 down from there. 1, 2, and 3. So I'm at the 5th intercostal space, and then I'm going to go for the mid-clavicular line. Okay, sir. Great. All right, I got a good pulse. The rate is good. The quality is good. All right, sir. Alright, so what I'm going to do is listen to the same area there, okay?
Sure.
And what I'm doing here is I'm listening to your S1 and S2 sounds. It's basically like your blood pressure. During systole, your semilunar valves open and your mitral valves close, which is at the apex of the heart, which is where I'm at right now. Okay, I'm listening for that, okay? Excellent. And then there's also another sound that's your diastole, which is your diastolic pressure, excuse me, which is your semilunar valves closing and your mitral valve and tricuspid open. Good. Alright, sounds good. Alright, sir, I'm just going to do a couple other pulses on your interior of your chest. What I'm going to do is called, just checking 4 different valves. Your aortic, which is on your second intercostal space, right sternal border, your pulmonic, which is on your second intercostal space on the left sternal border, your Erb's point, which is the third intercostal space on the left sternal border, your tricuspid, which is on the fourth intercostal space, right sternal border, and then finally your mitral valve again, which is on your fifth intercostal space, mid-clavicular line. What I'm doing is listening for the quality, depth, and the rate. Okay, good. First one. Tricuspid. Finally, mitral. All right, sir. Thank you very much.
Alright, appreciate it. Thank you.
Hey, Mr. Doe, how you doing, sir?
Hey, Chris, how's it going?
Good, good. All right, sir. So today we're going to check your peripheral vascular system. Okay.
Okay.
We're going to check basically see how make sure the blood's circulating correctly to different parts of your body. So I'm going to go ahead and need to get in there and touch you again. Okay.
Yeah, that's fine.
So the first thing I'm going to check is your carotid artery, which runs along the sternocleidomastoid muscle in the neck. Okay.
Okay.
And how I locate that is I just put my hands on you here, go up the muscle. All right, I got the muscle. What's in that? All right. I'm looking for amplitude, rate, quality. Good. And then on the other side, turn toward me. Alright, sir, okay. Alright, sir, now I'm going to do is I'm going to check your jugular vein. Alright, looking for any distension or anything. What I'm going to do is I'm going to raise your head up a little bit, okay?
Sure.
Let's see. I want about 30 to 45 degrees.
Okay.
So that's good right there. You comfortable?
Yeah.
Alright, sir. And I'm going to raise your bed up a little bit just so you're at my level. Alright, sir. And if you go ahead and tilt to the side, maybe look over there at that bag hanging. There you go. Perfect. Alright, and I'm going to go ahead and inspect the neck. Look for any pulsations of the JVD. None noted. Okay, sir. Thank you very much.
Sure.
Alright, sir. I'm going to go ahead and keep you at that level there. That way I can move around on you.
Sure.
Alright, so the first thing I'm going to do is, can I take this down for me?
Yeah, sure.
Alright, so just go ahead and relax for me, okay? I'm going to inspect and palpate the arm, looking for color, condition, temperature. Make sure he's nice and warm, dry. I'm looking for any skin turgor, which is pinching of the skin and it doesn't go back. It looks good. Looking for any pitting edema, swelling. Looking at the nail beds, looking for color, angles, capillary refill. Make sure I get less than 2 seconds response. Each finger looks good. Okay, that's good, sir. All right, I'm going to do is feel your brachial artery, okay, which is on the inner aspect of your arm. Okay. All right, sir. Looks good. I'm going to go ahead and check your radial pulse here, which is on the thumb side. Inner aspect of the wrist. Looks good. And then the other side. You're fine. Okay. Alright, and just your arm out there for me. Just straight up. And actually, I'm going to find that one in your fossa. That way I don't have to go over on that side. Okay, and that's in your antecubials fossa. You can also find that location. Okay. Alright. Alright, sir. Now what I'm going to do is go ahead and, if you could just take the blanket down for me.
Sure.
All the way down. There we go.
All right.
There you go. Alright. Sit on back and relax.
All right.
Alright.
Don't worry about it.
Well, you're fine.
Thanks.
Alright, sir. So the next one's going to be your femoral artery.
Okay.
What it is it's below the inguinal ligaments, on the anterior superior iliac crest, between the pubis and the anterior superior iliac crest.
Okay.
Okay. So what I'm going to do is locate the top of your iliac crest there. Okay. And then the pubis bone. There we go. Good quality, rate, amplitude. And then on this side. Okay. All right. So far, so good. Everything looks great. The quality, rate, all those pulses are excellent. Next is going to be the popliteal, which is behind the kneecap.
Okay.
So I just need you to kind of relax as much as you can with a little bit of a flexed position. Ideally, I would have you laying on your stomach for this, but I could feel it like this also. Good on both sides. Good on that side. Flex. There you go. Kind of anton. There we go. All right. Great.
All right.
Now I'm going to go ahead and palpate, inspecting, looking for skin color, hair growth, temperature, condition, color. Looks good, feels good. I'm looking in the nail beds for any discoloration, capillary refill is diminished, skin turgor. Okay, looks good, no pitting. As I'm down on this lower ankle here, I'm going to go ahead and check his posterior tibial pulse. Excellent. And on this side. Okay. Work my way down this. Put you up a little bit.
Sure.
There you go. You're fine.
There we go.
Okay, the skin, checking the skin, looking for any skin checking the color, condition, temperature, looking for the hair growth, everything looks good, no breaks in the skin. Skin turgor, give it a pinch, goes back to normal, good. I'm looking at the nail beds, looking for color, capillary refill, less than 2 seconds, alright. Looks good. Check his posterior tibial also again. Alright. Next thing I'm going to do is check the dorsalis pedis, which is the pulse between the first and second toe on the top of the foot. Alright, good on that side. And then on this side. Alright. Okay, sir. So far everything looks good. Your pulses are nice and normal. What I'm going to do now is go ahead and get your blood pressure, okay?
Okay.
Alright, sir. What I need you to do is I'm going to go ahead and just take one little pillow from you.
All right.
You okay like that?
Yeah, it's fine.
Alright, sir. Check for your brachial artery. Again, like I said, you can check it in the fossa, which is I'm going to do right now. And cubis fossa. Alright. Good landmark there. Okay. Alright, sir, just relax for me. Alright. Alright, sir, I'm going to go ahead and pump up it so I no longer feel your pulse. Get you right about 130 there where it went away, okay? So I'm going to deflate this.
Sure.
Alright, sir. I'm going to put my rail up real quick. Oh, actually, let's keep this one down. I'm just going to grab my stethoscope, okay?
Sure.
Alright, sir. Again, on the brachial, I'm going to go 30 more up than when it originally disappeared from the last reading. So right about 160. Okay. Alright, just relax. Excellent, so I got you about 128 over 78.
Oh, perfect. That's good.
Alright, Mr. Doe, that's all the assessment for today. I'll be right back in and we'll go over your respiratory status. Okay?
Alright, thank you, Chris.
Alright, Mr. Doe, how you doing?
Hey, Chris.
Back again.
Yep.
Alright, sir, now what we're going to do is check your respiratory system. I just want to make sure everything's working properly. I'm also going to listen to some lung sounds on your anterior and posterior, okay?
Okay.
Alright, so the first thing we're going to do is going to have you sit up for me.
Okay. You want me on the side of the bed?
Yeah, can you? Yeah, that'd be perfect.
Yeah, I think I can do that.
Yeah, just swing your legs over there. Alright.
Here we go.
Okay, sir. So I need you to do, you have any trouble breathing?
No, not really.
Okay, so just sit nice and normal, breathe nice. Take a couple deep breaths for me. Alright, I'm looking for symmetry. I'm looking to make sure that nothing, his chest is rising and falling, no retractions, no pulsating. Okay? Right. And then, alright, sir, that looks good. Alright, I'm going to just listen, you just take actually what I'm going to do first is I'm just going to count them, okay?
Okay.
Alright, so just breathe nice and normal for me, okay?
Mm-hmm.
Alright. So I got you right at 18 breaths per minute. Okay, so that's a normal range.
Alright, perfect.
Alright. Now I'm going to go ahead and just listen to you, okay? What I need you to do is each place I place the stethoscope, just take a nice deep breath in and out for me, okay?
Sure.
Yeah? Alright, sir. Alright, so far so good. All your rate and quality and depth of all your respirations was normal? What I'm going to do is assess your posterior, but what I'm going to do is raise the bed up to my height, okay?
Sure.
Just because I don't want to crank my back, and just makes it safer for me and you.
Okay.
Alright, sir. So come around your back side, assess your posterior here.
Alright.
Okay, again, I'm looking for any asymmetric movement. I'll make sure the coastal angle looks good. I'm sorry, in the front side, I checked the coastal angle and the diameter. And then for the posterior, I'm just checking to make sure his lungs are expanding normal, no retractions, no intercostal breathing, accessory muscle breathing, I'm sorry. Alright, sir. Again, with the breaths, every time I place it, okay?
Sure.
Go ahead. Good. Good. Okay. 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 Good. And one more. All right, sir. All your rate, quality, and everything of all your breaths was equal. No issues to report, and you breathing okay?
Yeah.
All right. Thank you very much.
Okay, thank you
Have
very
a great
much.
day.